Colorectal cancer is the second leading cause of cancer-related death and third most common cancer diagnosed in both men and women in South Dakota. The good news is when found and treated early, the 5-year survival rate for colorectal cancer is 90%. Because many people are not getting tested, only about 4 out of 10 are diagnosed at an early stage when treatment is most likely to be successful. Evidence shows a recommendation from a healthcare provider is the most influential factor in persuading individuals to be screened. Colon cancer screening guidelines can be a source of confusion for patients and for clinicians. That's why the South Dakota Council on Colorectal Cancer has pledged to support 80% by 2018 and encourages evidence-based recommendations for colorectal cancer screening.
The way I look at the provider's role in colorectal screening is if we make the recommendations, patients trust us. They look at us as a reliable source, and if we recommend that, that's key to them having the screening done. I think providers play an essential role by making this part of the yearly routine questions that we ask patients, and so that we don't miss patients. I think all patients over 50 should be screened, but there are patients with personal history, family histories that maybe aren't aware of their risk that need to follow different guidelines.
Providers can engage their practice to screen every eligible patient for colorectal cancer by making it part of the rooming process. I think that the best practice for explaining to the patients the benefits of screening is to have a one-on-one discussion with them individually on the importance of colorectal screening.
A colonoscopy is recommended every 10 years for patients without risk factors or symptoms. Recent studies have validated the long-held belief that removal of polyps through a colonoscopy can greatly reduce the incidence of colorectal cancer. Physicians have also known for many years that stool-based testing can reduce the incidence of colorectal cancer-related death. A fecal occult blood test was designed to identify existing cancer and should be performed annually.
I think a lot of patients are not familiar with the FIT test, and it's our opportunity to inform them about this, that this is an easy test, and if we do it once a year, they don't have to follow dietary restrictions. Very easy to do.
With all of the screening options available today, it is critical physicians counsel their patients about the importance of early detection in order to save lives. Remember, the best colon cancer screening is the one your patient actually chooses.